Yeah, so today we'll be talking about obesity.
Obesity, yeah. It's a big topic out there.
Yeah.
The convenience food that we eat, the junk food that we eat, the way things are marketed, and how convenient it can be. Like drive-through nowadays,
Yeah.
like obesity is on a rise because it's so easy to get your hand on all this junk food.
Yeah.
Oh dear.
Oh dear. So the reason why we're discussing about obesity is because we notice that there's a rise of obesity, not only in North America, Canada, but as a whole,
All over the world.
all over the world.
Yeah.
And how's this going to help benefit you? Well, first of all, you wouldn't want to get, the bigger your belly size, the worse it is for you. The more you're going to have, feeling tired, have other diseases and everything like that. So in order to do that, we want to help teach you on, some of the things that to help reduce obesity. And I like what Blenda is saying about how, the increase of food, readily easy accessible food. Tim Hortons, it being in Canada, Tim Hortons just around every corner of the major major intersection. McDonald's, they're everywhere as well too.
They're everywhere, yeah.
Yeah.
Now and then now they're on something so easy like an app, Uber Eats, right?
Yes.
Delivery systems. There's so many things that like food just comes to your door. You don't even need to go anywhere.
You don't even need to go anywhere. That's exactly why.
Oh.
Convenient, but you're not being like, people are not being as active because we're not going out there like back in the days to hunt like the cavemen.
Yeah.
For food. The food comes straight to us with the click of a mouse. It
comes to you, yeah.
Or button.
Yeah, that's why obesity is on a rise, and it's just so easy to get your hands on all these junk foods and foods, right?
Is it on the rise is because you think that people are being less active than before? Or like, what are the reasons why you think it's...
Well, I do think people are less active nowadays because we're spending more time on screen time than ever.
Yeah.
Work is, you work from home. You work in front of a computer.
Yeah.
You work in front of a screen. You have your cell phone. You're always working. I think people work anywhere between 8 to 10 hours a day, depending on the job you do. And some people even on weekends too, they have to work because now they work from home. So they're not as productive. When you're in a job, I guess you are more productive. Because, you check in, you check out. But when you work for ourselves, like Jenny and I, we work for ourselves, you're always thinking, you're always working. So you're always in front of a screen, you're in front of a TV or a cell phone. That way, I feel like we're less active in that sense.
Yeah.
But I know you for sure, Jenny, but we make it a point, like I make it a point as a personal trainer to flip that switch and be like, I have to make it to the gym 3 days a week. That's my idea.
Move your body.
Yeah, like I have to move my body every day.
Yeah.
On my lunch, I go for a walk. That's something I do. I don't have a pet, but if you have a pet, you can take your dog for an extra 10 minutes.
Yeah.
That takes no time at all. Yeah. But, obesity is on a rise for children, especially because of the foods we're introducing to them a lot earlier.
Yeah, that's true. Back to the point when Blenda said about the screen time, there actually has been a study. I can't remember. I read on it. It was about telecommunications. They noticed, like, especially during the pandemic, there's significantly increased screen time all across border. So like all ages across border, and there's increase in mobile screen time as well too, from A to Z, right? So the amount of time that's spent on the screen is a lot more, not only for playtime, but also for work as well too, right? And according to the WHO, the World Health Organization, there's a lot of, they suggest, like for an hour for children of like running around being active.
Yeah, 60 minutes a day.
Expensive. Yeah, it could just be like at least minimum moderate, right?
That is so little. I feel like kids need to be outside more than 60 minutes a day.
Yeah, right.
It's like that's hardly anything. Like they sleep, okay, fine. They sleep 12 hours. Then they have an hour outside. That's 13 hours. What are they going to do with the rest of the time? Like they need to be outside like 3-4 hours a day minimum.
Yeah. Well, That's the thing, is that, everybody's been put in this compartment, like, a little box, and the space is limited, and real estate is costing a lot, and also people are so busy. We're so used to this go, 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 go all the time. And because of technology, the great thing about technology, it is that it's supposed to help us, right? But at the same time, the advancement of technology makes the business, or makes the landscape of work more competitive. So people are constantly competing for a certain job, a certain position. Business are competing for, the market share and all that stuff. So there's a lot of pressure in that sense, that time is money. And so people are so focused on that, like, I need to produce in order to get that, right? So that's why I think they're on the screen all the time. And not only that, she mentioned about increased rise in children obesity. I was one of my mom's friend came over to visit. She's from Vietnam, and she was telling me about how in Vietnam they have my idea of Vietnam was used to be very like agriculture, but certain city they're developing, so there's a lot of commercialized and they're putting in McDonald's, KFC, pizza, or like a whole bunch of franchise there. So the food that they make, for someone, because of the lack of education, she mentioned that there's a lot of people who are still not as educated, and the food, the fast food, of course, when it's greasy, tastes really good, right? Because of the savory, buttery oil and the flavor, and the sweet, right? All these triggered like the dopamine nergic effect of like, the reward system. So it makes people want to eat more of it, right? People don't know that, okay, so all those fried food is not good for them, and the parents are working all the time, so they'll just give the kids some money because it's easy, it's convenient, it's just right around the corner. Get a burger, get a fries, right? Get that pop drink. So she said that there's more people, more children too, that are more obese, and also they're more diabetic, diabetes, even in the children population in Vietnam. I was surprised by it, right?
In the 70s, I think that's when like, Coca-Cola and drinking milk was like really big, and McDonald's like had their, I mean, even now McDonald's has their like commercials.
Yeah.
But, like it was really new, back then, right? When people started having more television and more ads coming through, right?
Yeah.
I think, it's really hitting all across the country, all across the world, actually, knowing that that's happened. Because even in China, the places that are not as developed, they don't have access to this junk food or this fast convenient food.
Yeah.
They still go to the market and buy fresh produce, fresh meat, right?
Yeah.
Their source of junk food was like, I guess like noodles. Yeah. And it would be like still freshly made in front of you from like a noodle hut, right?
Yeah.
Noodle hut. Yeah. So it would still be fresh noodles, and it was still, somewhat convenient, but like fresh food still.
Yeah. Yeah. The quality of food, because when you're coming from, especially if you're from a poor country, you rather have food, any kind of food, than no food. And sometimes it's the quality food might not be quality food, but because of when you're living under poverty, any food is good. And like I'm not going to be worrying about if it's healthy or not. I just want to get my meal, my next meal in, right? And that's the thing.
Eating, right?
Yeah, right. So, and they make it so easily accessible, and it's cheap, and like or at least they think it's affordable. So I think that's what people don't understand.
Yeah, they don't understand it. Because we've said this in the past, like eating unhealthy is actually more expensive for the future. Yeah. Because you're going to think about all the medical expenses that you're going to have, right?
Yeah.
You could develop diabetes, hypertension, like, have cancer. Like that's a big expense, like a huge medical expense that you can, like, it's hard to pay if you unless you have like insurance or you have medical care, right?
But not many people do, though, even in the developing country or in the first world country. Like how many people in the States or even people in Canada, how many of them actually have free access or access to healthcare?
Healthcare, yeah.
Yeah, Canada more than the States.
More than
In the States, people have like a lot of times if you don't have insurance, you're out, you're done.
you're screwed, yeah.
Yeah, right.
You're homeless because you have to pay for your medical expenses because you need to pay for the medical expenses.
Yeah.
You do, yeah.
Yeah. So
I've seen documentaries like this, yeah.
Yeah. So what are some of the solution in terms of like helping with reducing obesity? Like what do you think?
I feel like a lot of it is education, like educating yourself. Taking the time out of your day to educate yourself is very important. I know we always talk about this, like, if you don't bring in the food, it's not going to be in your house.
Yeah.
It's really hard to control sometimes.
Yeah.
So, first of all is like educating yourself, knowing what foods are actually bad for you and what foods are good for you. That's one thing I really like to focus on. And when I work with people, it's like, okay, well, let's slowly move there. It's not all or nothing.
Yeah.
Right. Like you don't have these healthy foods in your household, in your pantry. Okay, well, this week you're going to get this. Next week, you're going to get this.
Yeah.
Then the following week, you're going to get this. But we're going to slowly eat out all those foods first, because I don't want people to be wasting their food too, because it's just not doable. Like I don't like to waste food, but it does take time in order for you to phase out the poor food out of your home.
Yeah.
In order to bring the good food in. And I know working with a couple of my clients, they're very good. They only eat healthy food, and them just incorporating working out, they're already seeing great results because it's all diet. It's like 80% diet, right? Yeah. So really educate yourself. I mean, there's lots of books out there. There's lots of, now YouTube teaches you everything. So go on YouTube, learn more, and really just work on doing it yourself and slowly bringing your family to it and really just educating. And that's why we do these videos, because I think if we could educate people out there and slowly just one person at a time, just change lives, it matters, I think. That's why I think Jenny and I, we're really passionate about doing these videos, because we really want to help people one step at a time.
Yeah, that's amazing, Blenda. It's true though, because Blenda's in the nutritional field and also personal trainer. And for me, I've seen a lot of patients in the ER as a registered nurse. So we notice that this is a big problem. It's not something like we make it up. And like the CDC and also the WHO, all of the stats are showing that there's a significant rise in obesity and among other diseases, right? And a lot of times it's that people are not aware of it. And just by even for us to bring some awareness of like, what food to take, what food to eat, or like tiny little habits of what to do, right? So like, how Blenda said, out of sight, out of mind kind of idea, right? Like choosing food in its whole form, don't bring junk or avoid bringing junk in your house, right? Or replacing certain food, like certain choice of food with another one. And a lot of times people, think of buying because of how everything is costing so much, right? When you take good care of your health, right, like right now, later on in life, it helps you don't have to deal with the medical bills. You have more energy, and at the same time you can still be more productive. And for those who want to work, they can still work even in the older age, right? Whereas if you don't have your health, it's harder to do those things. So what we want to do is we really actually want to encourage people for that. And so I think that's really important.
That's good. Thanks for sharing that, Jenny.
Yeah. So stay tuned. We have a lot of tips in terms of like solutions. You can look back into our previous videos of what we did under the health and wellness section of my page, and on Blenda's page, she's got tons of tips because she's totally a nutritional expert. This lady, she's like wholesome, healthy, active,
Oh, thank you,
Mama
dear.
too.
I just have a bunch of stuff that I kind of enjoy. Like I like nature, so I put it on
Yeah.
there.
Yeah. Oh,
It's
nature
stuff
is
that I enjoy.
good. You know why nature is good? When you're in nature,
Ecotherapy.
yeah, it helps relaxes you, makes you feel good about yourself, and also it doesn't trigger the cortisol effects, right? When you're under stress, your cortisol goes up higher, and not only that, increase the risk of obesity as well too.
Yeah. I know I'm so light and airy. I know that. I'm always like, whoo.
Yeah, because when you're stressed out, you know what you do? When people are stressed out, some people they eat because it makes them comfortable, right? Some people do, they'll eat because it's like, I'm so stressed out.
Yeah, yeah. But
Right.
that's the last thing you should be doing. I think if you're stressed, go for a nice hike, get outside,
Yeah,
enjoy the nature.
yeah.
Now I
Work
de
it out.
Yeah, now I developed a really nice habit on Tuesdays to go for a walk.
Yeah,
And I walk around the lakefront. It's so beautiful. Like
yeah.
I can't wait for the winter actually, because you're gonna see the lake frost and it's just gorgeous. Like I really love getting outside and just being in nature. So good for you.
Being in nature, move your body, even 5 minutes, 10 minutes or more. Yeah,
5K for this girl here.
not all the time, sometimes.
Some days, yeah.
Yeah,
It's
most
good.
days. No, just kidding.
Most days, yeah.
Yeah. Anyways, I think do you have anything else you want to add?
No, I think that's it for now.
Yeah, it's a good intro to our obesity topic, and then we will give you more information with the other future videos that we'll do.
Okay.
Okay. Thank you so much.
Have a
Bye.
great day. Bye-bye.